California, Berkeley. I am originally from Trinidad and Tobago, so I am an immigrant to the United States. I'm trained as an education school psychologist, and so my work really focuses primarily on children and adolescents, although some of my work has now gone into the adult phase. And I came to the US to do my PhD, actually, to study dropout prevention. I was principal of what in the US is called a continuation high school. And so I was very interested in what are the things that, in fact, support students in staying in school rather than dropping out. And that's how, in fact, I come to the time perspective work. And so I think I'll stop there and I will dive into the talk today, and I hope that you find it interesting, and that, looking forward to some dialogue as we move forward. So this is a brief outline. I was lucky in the sense I think school psychology thinks about prevention as a really important aspect of what we do. And so, in fact, in the program that I run at UC Berkeley, we teach consultation really early on, because we encourage our students to think if you can prevent something from happening, or you can intervene early before it becomes a big problem, you actually well on your way. And so talk about that. Then I'm going to talk about time constructs as risk and protective factors, and then go through sort of predicting risk and resiliency, making the argument that this is an individual differences variable that, in fact, would be very useful in the context of a prevention intervention. So to set the stage for this, the Flexner report in 1910, which was aimed at physicians, talked about the physician role being modified. That while the relation of the physician was formerly to the patient or the patient's family and therefore remedial, it is in fact becoming social and preventive rather than individual and curative. So going back in the early 1900s, we have this idea about preventing disease and stuff and promoting well-being, rather than simply waiting for somebody to get ill and then curing them. And of course, there are many social determinants of health. Education is the one I focus on. I have some of the others here on this slide, but education is the one that I see as key. And education, of course, is the purview of school psychology. We focus on education and mental health. And in mental health, we are talking not just about sort of emotional health, but behavioral health and social health as well. Education more broadly, of course, is this global protective factor, right? So that educational attainment increases one's health knowledge and literacy and behaviors. It increases, so it leads to better nutrition, recognizing the importance of exercise, using less drugs and alcohol. It has important implications for the work setting, in terms of the working conditions that one gets if one is well educated, the resources that one has, the income that one gets, and ultimately sort of personal factors, sense of control or agency, social standing in a society, and in fact the ability to in fact have social support. And all of these, of course, have implications for health in the broader sense. So school psychologists, right, in supporting educational attainment, our goal is, in fact, to contribute to the general public health of society. And education, we see education as a general public health issue, and a critical role in having everybody benefit from society has to offer. This model, the population health model, is one that's probably very familiar to those of you in public health. And this idea of the mass of people being healthy, we have some smaller group being at risk, and an even smaller group that has a diagnosis. And for those who get diagnosis, we want, of course, effective and efficient clinical care. We want to mitigate risk and early intervention for those who are at risk, and we want to keep those who are healthy. I was sharing with our host earlier on today that, in fact, I keep saying to my students that our ultimate goal is to do ourselves out of a job, because if we can get everybody healthy all the time, there's no need for us at least to be doing the curing part, but we can actually then work on sort of promotion, right? And one of the things, again, I learned in my doctoral program is this idea of anticipatory guidance or emotional inoculation. So if we think about fluoride in the water to prevent cavities, we inoculate children who go to school, right? We can think of, in fact, the same kind of thing, that same kind of inoculation, but on a psychological level, much like, again, we screen for hearing and vision at the beginning of school, right? And so we can work towards creating what I would call, several colleagues and I would call, positive psychosocial profiles in youth. And these psychosocial profiles, we would argue, would help youth not just succeed educationally, but actually help their peers. And that ultimately, as more and more youth are positive in their approach to the world, that in fact you build a larger society which has greater public health. And there's a growing body of evidence that speaks to the importance of time constructs in terms of its association with educational outcomes, risky behaviors, and general adaptive functioning. And so that's where a lot of my work is going to come from. So if we're thinking about ingredients in prevention for youth, we can certainly think of supportive environments, both home, school, societal environments. We can think a sense of belonging and belonging more broadly, belonging to your demographic group, your sense of belonging in society. Is your group affirmed within a society, treated with respect, and so forth. And I would add time constructs into that mix that would lead to positive adaptation. And I would argue that, in fact, time constructs are particularly important at the general level for everyone, and then at the area where you have risk. Now, I know, for instance, there's something called time therapy that people are doing, people who are diagnosed. So it's even been used at the intensive treatment phase. And so now to pivot to the heart of my talk. So time perspective has been around for some time, and in psychology, and it's been described, Levin called it the totality of an individual's views of his psychological future and his past at a given time, so in the present moment. Zimbardo and Boyd called it an individual difference variable. The sense personal and social experiences are decomposed and allocated into temporal categories. And Adams, 2009, described it as something that influences human behavior. So it really has been seen as something that's really important. In early as 1939, a researcher named Frank argued that all human conduct is conditioned by the time perspective of the individual. And I was an English teacher before I was a psychologist. In fact, I studied four quartets in secondary school. T.S. Norton, in one of the four quartets, Norton has the phrase time past and time present are both perhaps present in time future and time future contained in time past. And in essence, this is what the psychologist was saying as well. Time perspective shows up in several theoretical perspectives. Erikson's psychosocial theory, which in fact undergirds a lot of my work. Erikson's talked about the infant developing hope, and this idea of trust versus mistrust in infancy, that the infant is struggling with. Are the parents receptive? Are they feeding it? Are they changing it when it needs to be changed? That becomes time perspective in adolescence. He argued that the idea of inferiority versus industry at the school age becomes anticipation of achievement again in adolescence. And so this idea that time perspective is a really important psychological construct. And Piaget actually postulated that the capacity to understand time was an indicator of intellectual development, as it represented abstract thinking. Of course, time perspective is not a singular construct. There are multiple constructs associated with time perspective. On the slide, the things on the right are ones that in fact are very clearly temporal: consideration of future consequences, hope, possible selves. But on the left, there are many of these constructs that we study that we know in fact have an impact on functioning, that actually have a temporal component even though we sometimes don't think about that. So self-esteem, for example, is feeling good about yourself in the present time, right? Nihilism, no sense of a future. Fatalism, the future is not going to work out. Purpose, working towards a greater good. Self-efficacy, acting in the present so that you get a positive future outcome. So as you can see, this time constructs are really present in many things we do. You note in the list of direct, what I call sort of the direct temporal constructs, that these are all focused on the future. And a lot of our early work in this field was focused exclusively on the future. So in one of my early studies, looking at, again, at-risk youth who are at risk for dropping out, I looked at perceived life chances in a group of, in 3 groups. A group of students who were designated at risk. These were students at a continuation high school. A group that was at risk that was designated resilient. These were students who were at risk and they had been offered an after-school mentoring program. These were the ones who accepted the program. So there were some who did not, but these are the ones who accepted. And so we designated them as people who are wanting to, in fact, get their risk mitigated. And then another at-risk group. And the measure of perceived life chances is a global measure, 10 items, asked what are the chances that you will graduate from high school, go on to college, be able to live where you want, be respected in your community, have a happy family life. So it's this global sense that the future is going to work out for you. And what we saw is that, we also measured self-esteem, which at the time was considered sort of the gold standard for prevention or as a protective factor. And I was not as convinced. And what this slide shows is that the self-esteem of these groups did not really differ. You can see the effect sizes are 0.2 on and going down, whereas the self-esteem for the students' perceived life chances was substantial. The students in the continuation school had substantially lower perceived life chances than the students in the mentoring program and the academic program. So the ones who we thought were resilient were in fact showing perceived life chances that was equivalent to a group of students who were not at risk, right? In my dissertation study, I actually looked at, did a prospective and retrospective study looking at students at a continuation high school. So the retrospective study included 2 groups, students who had graduated from the continuation high school in the previous 2 years, students who had dropped out of the continuation high school in the previous 2 years. The prospective study, we actually collected data at the same time as we collected from the graduates and dropouts, students who were continuing to attend that school. So they were in school at the moment. And then 2 years later, we saw who had dropped out and who had graduated. And we were looking to see what were the variables that would predict. In the retrospective study, the students' recollection of risk trumped the protective factors, right? And the variables, missing classes or cutting school, grade point average, the importance of college, hope in the future, and perceived school climate were the protective factors. But we got 90% correct classification with the risk factors versus 81% with the protective factors for the retrospective. In the prospective study, it actually flipped. And in fact, what turned out to be the important variable was hope in the future. And the other variables went away. And so that was an initial study. There's also a scale called the Hope Scale, which one of my students, and I'm going to share some of his work, has been using. It's called the Hope Scale. It's a 6-item measure. It measures agency, which is the belief that you can accomplish your goals, and pathways, the ability to envision multiple goals, paths to envisioning your goals. So if I'm wanting to, let's say, go to college, but I do not do well in California, for example, I don't do well enough to get into a University of California campus, I can go to a community college. And if I do well there, I then can transfer into the University of California. So this idea of pathways. And so there's some work using this Hope Scale. This is one of my teacher education students' master's thesis. And this is an interesting study because small ends, but there's a group in the southern United States who are referred to as travelers or American gypsies. And they are typically considered at risk. They're typically out of school by the end of middle school. They go on the road. They are really an insular ethnic group. They're a white ethnic group in the United States, and so considered education at risk. Now, they live in rural parts of the south of the United States, and this was when we were looking at the differences between the groups, we found these interesting patterns. These are people who would travel, they spend a lot of time on the road, and they come back, bring the money back home. And so they tend to be doing better than the individuals in the rural area where they live. They tend to have higher SES. And that's what we saw, right? So that in fact, the travelers reported higher perceived socioeconomic status than the non-travelers, right? There was no difference in the perceived utility of education. These are the kids, by the way. But in perceived life chances, we can see that the children of the travelers are reporting substantially lower perceived life chances than their peers. And it seems to be connected to the educational expectations of their parents. So even though these students see the utility of education, they don't differ in it. Their parents' educational expectations for them are not high. They're going to be pulled out of school. They're not going to stay in school. Now, interestingly enough, they're reporting higher ethnic identity, which makes sense. This is a tight-knit group. They're reporting lower other group orientation. They are not willing to engage with other groups as much. They also report high hope because these are people who survive. So this idea of agency and pathways, they survive. But it was an interesting way of looking at seeing how these individuals were considered at risk, the psychosocial profile that they had, and how it differs from more traditional groups. This is my student, former student Dante Dixon. He looked at hope and found that in fact it predicts academic self-concept beyond demographic variables, making substantial contributions. It also, in this study, they also predicted motivation, attitude towards school belonging, and goal valuation, substantial predictions there. And in this study, we actually did a cluster analysis where we actually classified students into 4 groups. Those with low hope, those were high agency but low pathways, those were high pathways and low agency, and those with both high agency and high pathways, so high hopers. And you can see across a range of variables that in fact, the individuals who have high hope, their academic adaptive profile is much different than the individuals with low hope. So higher GPA, higher academic self-concept, academic investment, higher self-esteem, higher school belonging. Interestingly enough, perceived stress, the people who with high hope also had the lowest perceived stress, whereas those with the low hope had the highest perceived stress. So that again, this idea of the time construct acting as a profile, a psychosocial protective factor. And again, replicated in several studies. Here we are seeing the difference between high and low hope in terms of behavioral engagement, emotional engagement, work ethic, academic self-efficacy, and so forth. This is college students, high school students. We find the same pattern in college students. And then we looked at this in a gifted sample, right? So we think about gifted and talented youth in the United States. So this is a sample with our GPA grade point average, it's 4.0. It's typically considered, an A average is 4.0. These are students with a grade point average of about 3.8 on average. And so you wouldn't expect necessarily to see differences in this group. But even in this gifted group, this high-performing group, we actually see differences in terms of hope. You're seeing, and agency and pathways are predicting different things. They're contributing different things. So for instance, agency is predicting behavioral engagement, emotional engagement, not emotional engagement, sorry, work ethic, academic self-concept for self-regulation, while pathways is predicting curiosity, self-development, competitiveness. In other words, not trying to beat my neighbor, but trying to be the best I can be in a particular area, and so forth. And so when we put those together, we can see that, again, beyond demographics and perceived ability, the hope construct is contributing a substantial amount of variance to many of these things that we know are useful in an educational space and ultimately in lifetime. And we see the same thing with the profiles. We find the whole profiles in these groups and the same pattern again in this gifted sample. So one of the things that happened in 1999, Philip Zimbardo, the Stanford Prison Studies, introduced the Zimbardo time perspective inventory, and he argued that it was important to not just look at the future, which we were looking at with perceived life chances, looking at with optimism, with hope, and so forth. And it was important to look at the past, present, and the future. And so he published an inventory where he actually had 5 constructs: past, positive, past, negative, present, hedonistic, present, fatalistic, and future, and showed, in fact, a pattern of correlations where we see that, for instance, negative things are associated with depression, aggression, so past, negative, present, fatalistic, associated with aggression, depression, and so forth. Future is negatively associated with aggression. And so we see this pattern where your emotional connection to the time period, positive or negative, actually is making a difference between that it's sort of risk or protective factor. So a negative view of a time period is a risk factor, whereas a positive view seems to be a protective factor. And this scale is the most popular scale in the world. Some psychometric concerns have been raised about it, and given the psychometric concerns, there are some concerns that the findings will not replicate or generalize. A postdoc and I developed, and because we were particularly interested in adolescents, we developed a measure intended to look at these valence constructs in adolescents. The measure has since proved to be useful with adults as well, and so it's been renamed the Adolescent and Adult Time Inventory. But speaking specifically about the 5th construct on that, and there's a positive and negative attitudes towards the past, present, and future. And so we decided to focus on the affect more specifically, and past, present, and future. So positive and negative attitudes to past, present, and future. So the scale has 6 scales. As a psychologist and who is wanting to argue that we need to be using these things for intervention, psychometrics are really important to me. So I'm going to run through very fast a set of slides on the psychometrics, because we have done a lot of testing of this scale. So the internal consistency is working generally well across a variety of samples. Of particular interest to you, you might see that it's working in Northern Ireland as well. The internal consistency, again, looking at ethnic subgroups, we want to be able to look at groups that, in fact, are historically underrepresented in the literature, and not just in the US. We see it's working in ethnic subgroups in other countries as well. There are alpha estimates in languages other than English. It's working in several different countries: Swedish, Turkish, and so forth. The factor structure is holding up, as you can see here, across adolescent samples, but even into an older sample. The average age of that older sample was 70 years old. Factor structure is holding up in other countries as well, again, including Northern Ireland and stuff. And then convergent validity, showing that, in fact, is this, in fact, predicting the way we would hope it would predict? And we are getting the patterns that we like. So negative, positive time attitudes have negative relations to the perceived stress. The negative ones have positive relation with perceived stress, the reverse for self-esteem, and so forth. And one of your own, Michael McKay, did a meta-analysis of the psychometrics of this scale in 2020, and actually concluded that it was a robust measure from which valid inferences can be drawn. So just to say it's working. And so now I'll turn to sort of the heart of the work that I've been doing, and to show, in fact, how this has been playing out in many ways as we think through how this measure, how these time attitudes can be used as risk and protective factors. So I'm drawing from work from a number of different individuals. At the Time Perspective conference in 2016, a Japanese graduate student presented on the relationship between time attitude scores and ego identity clusters. So they identified individuals who were in these various categories: achievement, foreclosure, moratorium, carefree diffusion, and diffuse diffusion. If you're familiar with the Erik Erikson's the ego identity work of Marcia and the work of Erik Erikson, this idea of achievement and moratorium are typically at the highest levels. Foreclosure actually goes back and forth sometimes. There are people who argue it's positive, people who argue it's negative. Foreclosure is choosing a pathway without exploration. But diffusion is seen as actually having a problematic identity. And as you can see here, past positive scores are highest for the foreclosure, achievement, and moratorium groups, and lowest for the diffusion. The past negatives are highest for the diffusion and lowest for the moratorium, foreclosure, and achievement categories, achieved identity categories. Same thing for the present variables. Same thing for the future variables, the same pattern, right? These are some studies we've done of high school students here in the United States, just looking at group differences, right? So that users and non-users of tobacco, and so these are students typically aged 14 to 18 years old, that users are reporting, non-users are reporting higher past positive scores, users are reporting lower positive scores. Users are reporting higher present negative scores and lower positive scores, so that in fact, positive is associated with non-use, negative users, negative attitudes are associated with use. Same pattern for alcohol, and we actually have the same pattern for marijuana use, with the exception of future negative. Those are future negative. The non-users reported higher marijuana use. I don't know if I'm in Berkeley, California, and I will say that our city, which has many reputations, I think the students at the high schools in Berkeley have a different view of marijuana and its utility. But in the general pattern is the same for all of those. Looking at use, not just use, but use in school over the last 30 days. So these are students who are using cigarettes and alcohol in school. We can see that in point of fact that those who used alcohol to 20 to 30 days in the school setting are reporting the highest past negative, present negative, and future negative scores. Again, these are just associations, but we're seeing sort of this consistent pattern. When we look at using marijuana and other illegal drugs, again, we are seeing the same pattern. So the marijuana use is there, but the other drugs, other illegal drugs, you can see again the same thing with the negatives being higher. But here we also see a difference in the positives. When we actually look at just the marijuana data, you can see the positive attitudes didn't really predict when you just looked at cigarettes and alcohol. But now that we are looking at marijuana and other illegal drugs, we are seeing some substantial relationships between use and non-use, positive and negative time attitudes. Gang membership, people who are in gangs are more likely to have lower positive attitudes and higher negative attitudes. And perhaps not surprisingly, when we think about one of the markers for depression, feeling sad or hopeless for at least 2 weeks in the past 12 months, we are actually seeing the same pattern. And so we have these group differences that are showing us what we hypothesize these things are doing. Now we'll look at some sort of associations. So we did some structural models. In this one, positive time attitudes are predicting intrinsic motivation engagement, which then has a negative relationship on alcohol use and marijuana use. And in fact, the positive time attitudes, the indirect effect of positive attitudes on behavioral engagement is 37%. And on marijuana, it's a 36% indirect effect. We're seeing the same thing with negative time attitudes, except it's going the other way. Negative time attitudes have a negative impact on intrinsic motivation, a negative impact on engagement, and these the negative impacts on alcohol use and marijuana use. In a study in Northern Ireland, we actually looked at future positive and future negatives to see, in fact, if it would mediate the relationship between SES and attainment. it was not really, it did not. We did not find mediation, but we did find that positive, future positive attitudes did have a positive impact on school achievement, and as did negative, had a negative impact on school achievement. And so while it's not acting as a mediator for SES, it is predicting. So one of the things that Zimbardo and Boyd also suggested in the 1999 study, which I think actually has revolutionized the field, was they suggested looking at profiles. That in point of fact, you know, when we look at these individual, we look at future positive, or we look at past negative, we're looking at individuals, but that individuals hold a profile of attitudes, and that profile of attitudes may be a useful thing to look at because it gives us a sense of the whole person. So sort of person-centered analyses. So we started looking, doing that work in the last decade or so. And we've done both cluster analysis in studies in the US, the UK, New Zealand. We have some work in preparation in Singapore and Slovenia. And we've looked at latent profile analysis as well. So we've done both using the raw scores and then the sort of the latent scores. And we found some profiles consistently. So this is kind of how the profiles look. So for example, this top left profile, here are the negatives. They have very high above the mean scores on past negative, present negative, future negative, and low scores on the positives. The bottom right is the flip, the positive profile, and then there's a pessimist profile. You can see future negative, top right, the high score, 10 standard deviations above the mean, and so forth. And we have an optimist profile. We found several different profiles in different studies. Some are more common than others. And so we've been looking at group differences. And these time attitude profiles are associated with meaningful differences or outcomes. And we found in a number of cultural contexts, national contexts, these differences. So again, I'll run through these quickly, but just you can see that positives and optimists are reporting the highest trust in school, the highest perceived support in school, and the most positive teacher-student relationships. In New Zealand, more positive attitudes towards school, academic self-ranking, and school marks. In the US, where we are looking at achievement, not self-reported achievement, but achievement from the school records, we are seeing that the conflicted profiles are reporting the lowest achievement levels. The positives are reporting the highest achievement levels. Another study in the US, again, where we are looking here now at school belonging, we see positives are reporting the highest school belonging, highest valuing school, and so forth. Singapore in preparation, we have school climate. You can see the pattern from negatives to positives on attitudes towards mathematics and math self-efficacy. We found the same pattern in psychological constructs. So life satisfaction, positives and balanced are reporting the highest. Life satisfaction, self-efficacy, the balanced reporting the highest. Perspective taking in the US, time constructs, we are saying the positives are reporting, of course, the highest hope. We've seen and this is hope based on that 6-item hope scale that we looked at, the highest optimism, the highest perceived life chances. And reverse, they're reporting the lowest hopelessness, and negatives are reporting the highest hopelessness, which of course is associated, has a higher association with depression, and negative association with self-esteem. We looked at cultural constructs. As you know, racism is a major issue in the United States, and not just in the United States, but it's certainly one of the challenges that our society faces. And so we were looking at, would these constructs be related to these sort of things like discrimination? And we really went into this with no hypotheses. Negatives are reporting the highest expected gender discrimination and the highest pessimists, the highest expected ethnic discrimination. Positives are reporting the lowest expected discrimination in all cases. Now, we know that discrimination exists. So this is not to say that discrimination does not exist. But if a situation is ambiguous, it is likely that the positives are much less likely to interpret it as discrimination, and therefore more likely to have a positive interaction than than somebody who's a negative, for example. In another study, again, perceived discrimination, Negatives are seeing more perceived discrimination than other groups. Again, the same thing, expected gender discrimination, expected ethnic discrimination, and also expected income discrimination. So this is it. In Slovenia, we looked at maladaptive coping. We are writing this up, and you can see the positives are reporting the lowest maladaptive coping, so they are less likely to engage in self-blame. The present negatives are ruminating a lot, which makes sense in the present. The positives are much less likely to catastrophize and or to blame others. And in terms of adaptive coping, we see the reverse, right? The negatives are reporting the lowest adaptive coping. Positives are more likely to report planning, positive reappraisal of the situation, and so forth, acceptance. We have also found, we looked at the big 5 personality traits. Positives are reporting the highest conscientiousness, agreeableness, and extroversion, and the lowest neuroticism. So these time constructs are in fact seem to be associated with a lot of things. And again, all of these are associations, and we can't randomly assign people to time profiles. So what we've done is we've done some longitudinal studies to see if in fact there are changes on the basis of profiles, and if profiles change, and if they change, do we see changes in behavior and attitudes? And so this was a UK study, I believe, actually in Northern Ireland, with Michael McKay, where when we look at, these are alcohol use, and these are people who stayed in the positive profile. So they were in the positive profile at age 12 and a half, and they stayed in the positive profile in age 13 and a half. You can see that, in fact, the positives were most likely to be abstainers or supervised drinkers, whereas people who were negatives and negative futures reported higher unsupervised drinking and both, and both types of drinking. So that in fact it seems to be related to behavior. Now this is the stairs. When we look at the people who are moving, we looked at the data, longitudinal data. We found that staying in the positive profile, a lower likelihood of ever having used cannabis compared to staying in a negative or the other profiles. Staying positive, again, a lower likelihood of ever having smoked. Moving to the positive was associated with moving a lower likelihood of lifetime smoking, so your behavior changed. Moving to negative, your lifetime smoking increased. We find the same pattern with self-efficacy. Staying positive is associated with increases in self-efficacy. Staying negative decreases in self-efficacy. And moving to the positive profile increases in self-efficacy. Moving to a negative profile decreases in self-efficacy. And we found this for academic self-efficacy, emotional self-efficacy, and social self-efficacy. And the last thing I'll talk about before I do start is sort of intervention studies. One of my students, my student, Dr. Dixon, is doing some hope interventions. I haven't seen the results of those yet. This is an intervention study that was done by some colleagues who I do not know. They are in Spain, and they actually did a positive psychology intervention at a high school in Spain. And they used the time attitudes, and they measured time attitudes and well-being at 2 time points. They had found 5 profiles and stuff, and then they did the positive psychology intervention. And after the intervention, they found that adolescents in the intervention group were more likely to move into the positive and optimistic profiles 1 week after the intervention, and they reported higher well-being. Another student of mine who just completed her dissertation in South Korea, where there's a big problem, one of their major issues with adolescents is problematic internet use. Actually, she translated the scale into Korean, validated it in there, and collected data on problematic internet use and on these time attitudes, and found that, again, positives were the least likely to be engaged in problematic internet use. So in conclusion, so these time attitude scores and profiles on clusters are related to a wide range of adaptive and maladaptive behavioral and social emotional outcomes, not just cross-sectionally, but also longitudinally. As I said, it seems to be like a psychosocial lens on viewing the world, giving you, and stuff. And that positive profiles, I think, can be used as prevention and intervention that if we can systematically intervene to promote positive profiles in schools, we may be able to change behavioral trajectories and attitudinal trajectories into ways that would be more useful to help the populations that we serve. Thanks for your attention, and I hope we have some time for questions.